Marshfield Clinic really has leveraged our information technology to help improve the care for our patients. And one example is we use an application that we developed called a patient dashboard. And what we're able to do is we have our tablet computer in our hands before we walk in the exam room with the patient, and are able to view several different panes of information that's sort of the condensed version of the patient's electronic medical record, and able to quickly see what their diagnoses are, their vital signs, medications, allergies, and other information, so that you have a real encapsulated summary of that patient before you walk in the room with them. And then when we're sitting face to face with the patient, it really is fantastic. We can kind of look through the chart even together, review old lab results, look at radiology reports, even look at the x-ray films themselves on our computer. And so really allows us to have all the patient's information at our fingertips and easily accessible. Where we pull information about patients' immunizations, past history of immunizations, other preventative services like if they require colonoscopy or mammography or pap smear, and then if they have any chronic diseases like diabetes, that we look at what are the measures that we need to take the best care of a patient with diabetes. For example, have they had their hemoglobin A1C checked? Have they had their eye exam? Are they having their foot exam? The different components that we know is very important to taking care of those patients. Marshfield Clinic itself is actually over 90 years old. It's a very large multi-specialty clinic, so we have physicians from a variety of different specialties in central Wisconsin, central and northern Wisconsin, and 43 different sites in our state. And we started in information technology actually over 20 years ago. We initially had our laboratory data in our electronic medical record, and then it has grown since then. We've actually been using for the past 10 to 12 years the electronic medical record to store our office visit notes. And so it has grown, and it's been around for a long time, and now is fully deployed throughout our system, actually in a chartless environment. So everybody has their tablet computers and are able to go from exam room to exam room with their tablet computers. So it really has been a wonderful development over the years. With having all the information encoded electronically, that gets put into our data warehouse, but we're then able to retrieve it using these different applications and getting back the information to the doctor, really the pieces of information that they need. And so we're able to give the doctor, looking at their panel of patients, who hasn't been in, which patients haven't been in, which patients aren't meeting goal, able to provide that information back to the physician and their staff to be able to then reach out to that patient and say, hey, it's been a while since you've been in. We don't want to lose them to follow up. They really need to come in for their services. And so we're able to get them in for their services. And so it really helps us to track and to monitor and really try to improve the outcomes for our patients.